Awesome. Well, everyone, it's so great to be here with you today. My name is Danny Rylander, and I work at the Washington State Department of Commerce in the Office of Apple Health and Homes and Permanent Supportive Housing. I'm the Permanent Supportive Housing Rent Assistance Supervisor. And as you can see from the photo, we had so much fun preparing this presentation for you today. So I'm very excited to be able to be in this space with you. Kimberly, did you feel like you still need to introduce? We're good? Okay.
I think everyone knows me well enough.
Oh, we need to hear it. No, just with your new titles. Awesome. Well, today I just want to start out by acknowledging that there are so many different resources in the system, and we hear all the time from you all as well as others that it's difficult to put it all together. And so I want to acknowledge that this presentation does not cover every single resource available in the state. We're specifically going to talk today about some components that the Washington State Department of Commerce, that the Department of Behavioral Health and Recovery, as well as the Housing Community Services and ALTA team offer, and that seem to work together, pair together well to help support our supportive housing clients. So today we're going to do our best to help identify some key components of those supportive housing in Washington State. Just mute there for everything. Okay, we're going to try to map how the services and subsidies from these different programs intersect to create this safe supportive housing for individuals with behavioral health conditions. And then hopefully we'll be able to provide you with some tools so that you can learn more about these subsidies and services available for folks with behavioral health conditions. We have, I'm not going to go through all the agenda. We're just going to jump right in. So I think I'm going to, can we have the next slide, please? Make sure I didn't miss anything here. All right, so I'm going to turn it over to Scott and Kimberly to chat about the Healthcare Authority programs.
All right, so I'm going to chat a little bit about the HARPS program, or Housing and Recovery Through Peer Services. Now, we know many of you are already working in many of these programs, so we're not going to spend a lot of time talking about what they are, eligibility, but we just wanted to kind of give you a brief overview in case you're not familiar with them. And of course, refresh you if these are programs that you know about or already work within. We know you want to get to the beef of some of the other stuff that we're going to talk about later in the webinar, but Housing and Recovery Through Peer Services is a supportive housing program. It's really about serving the folks that are to help prevent homelessness, that are coming out of inpatient settings, those folks that are either at risk of homelessness or going to be exiting into homelessness. We want to make sure that they have those housing interventions before they're exiting to make sure that they get support and get that support to get housing and continue to receive services beyond that inpatient setting. So I wanted to give you some data about HARPS because I thought it was really cool that, you know, in 2022, HARPS served 2,782 people. They housed 2,093 individuals last year, and they 591 folks got supportive housing services last year through HARPS. So I thought that was really cool. HARPS does come with a subsidy. It can be up to $2,500 per individual for up to 3 months. So yes, HARPS can be considered long-term for those folks that aren't on Medicaid, because you do not have to be on Medicaid for these services. So if you have somebody that's not Medicaid eligible, HARPS is a great option for them because they can be served through that program until they can be maybe eligible for Medicaid, or if they're not going to be eligible for Medicaid, you can serve through HARPS longer term. So really excited to share some of those numbers. We love this program. They follow the evidence-based practice of permanent supportive housing, similar to some of the other programs we have at DBHR. It's really about making sure that we can support people in getting, you know, those supports to get into housing, but also help them stay housed long term. Now I'm going to turn it over to Scott. Oh, wait, before I do that, these are some of the locations about HARPS. I forget that we have this region-wide now. So originally, HARPS was a pilot project. So we started it out to see how it would do, following those evidence-based practices that I spoke about. And now we were able to take HARPS region-wide. So there is a HARPS program in every region. Currently, King is up for an RFP. So King County is looking for a HARPS provider right now. And so as soon as we get a new HARPS provider will make sure the information goes out to people. So those of you that are working in the King County region will know where HARPS is available and how people can get served there. If you are interested in knowing more about the HARPS program, Wanda Johns is the program manager here at DBHR. There is an active link on this PowerPoint. You guys will receive this. So if you want to click on this, you can get the HARPS fact sheet and learn a little bit more about the program and kind of a little bit of the history behind it. And you can always reach out to Wanda Johns. She's a great resource. She is what we call the housing OG here at DBHR because she's been around so long and has been doing housing forever. And so she's a great contact to learn about supportive housing and also the SOAR program, and is a great contact for that information as well. One of the things I like to talk about with HARPS is how it's a great referral source right into foundational community supports. And Scott's going to talk about FCS in a minute, but we like to talk about this because we are talking about that continuum of care, right? That housing continuum. And so folks that are maybe eligible for Medicaid that come through the HARPS program, FCS is a great resource to get them connected to for that longer term support. So we always tell folks that are in HARPS, if they're serving someone that might be eligible for foundational community supports, that's a great way to get them into a longer term support situation where they can be served with Medicaid paying for that support services. And so this is like that continuum. They can get served through HARPS until they can get connected to foundational community supports and then continue that longer term support through FCS. So if you have questions about that process or that referral, please reach out. We'd be happy to talk about that more. But we always want to remind folks that this is a great way to continue to serve people, and then HARPS is able to go back and serve more people coming out of that inpatient setting. Now I'm going to turn over to Scott to talk about foundational community supports.
Thank you, Kimberly. I appreciate you. I just want to mention that I do see a few pieces in the chat from Stanton and Isabel. I'll be sure that those locations get added to that HARP slide. Thank you for highlighting that. Much appreciated. So Scott Tankersley here to talk about the Foundational Community Supports Program. Many of you are probably very, very familiar with FCS, so I'm going to keep it brief, but just want to dive in a little bit here and scrape the surface on FCS since it is such a big program here in Washington State. FCS was developed as part of Washington State's Section 1115 Medicaid Transformation Project Waiver, or MTP. The MTP aims to improve the health of Washingtonians by coordinating HCA's healthcare partners to address health-related social needs. Health-related social needs, just so folks know, that's another term that we like to use for social determinants of health. So just so folks know, regarding the MTP, we are currently amidst a waiver extension while HCA and the Centers for Medicare and Medicaid Services, or CMS, negotiate Washington State's next 5 years of the MTP under the waiver. It's a really exciting time for us. You know, FCS is part of what's being negotiated with CMS currently, and we expect that the waiver will be approved by CMS before July 1st of 2023. And once it's approved, we're going to dive right into our next 5 years of the program, which is really exciting. So FCS is known as Initiative 3 of the MTP, and two benefits or two services are offered to Apple Health beneficiaries who meet each service's respective eligibility criteria. So those two services being supportive housing and supported employment. So both benefits or services respectively assist enrollees with finding and maintaining jobs and acquiring stable independent housing. And to date, FCS has served over 27,000 individuals across both benefits, with a network of over 170 providers working across upwards of 500 locations across Washington, which we feel is pretty huge. AmeriGroup, some of you may be familiar with AmeriGroup, a managed care organization, or MCO, here in Washington State. They are the program's third-party administrator. And so AmeriGroup manages the FCS provider network, and so that means they authorize services and provide administrative oversight for the program. Next slide, please, Kimberly. And so, since we're focusing on Washington's housing landscape, I'll dive a bit further into FCS supportive housing services. But that said, I really want to highlight the crucial role employment and supported employment services can play in bolstering a person's housing stability. Plenty of folks who are eligible for supportive housing services within FCS are also eligible for supported employment. So I feel like it's really important to highlight that when someone earns income from employment, they oftentimes improve their quality of life and their ability to pay rent. A person's housing stability can be positively impacted by being employed, and we always want to be promoting that holistic approach to housing stability. That said, I am going to dive into a quick overview of FCS supportive housing services. And so, so long as a person meets FCS supportive housing eligibility criteria, which I'm not going to go over today, and they've been authorized by AmeriGroup to receive those services, then an enrollee is offered person-centered pre-tenancy and tenancy sustaining support services that adhere to key principles of permanent supportive housing, or PSH, which is an evidence-based practice, right? And in that evidence-based practice, there are some principles, and those principles really help support a tenant in being independent in their unit of choice. And so those principles being choice of housing, ability to flexibly and voluntarily engage in services, maintaining that separation of housing and services, establishing rights of tenancy through a lease, access to housing that isn't founded on an idea of readiness for renting, and that renters have rights to tenancy. And there are some other principles within that too, but just wanted to highlight those for folks that may not be familiar with those. Case managers work with supportive housing enrollees to identify an enrollee's short and long-term housing goals within the program. And case managers work closely with those enrollees to assist them with achieving their personalized housing stability goals at their own pace, which is pretty huge. If a person enters the program in that pre-tenancy stage, they'll receive benefit and treatment planning support, care coordination services, housing search and identification services, like landlord liaison services, advocacy, and more. And then if a person enters the program as a tenant or moves into an apartment while enrolled in FCS supportive housing services, they'll also receive a slew of tenancy sustaining services that aim to bolster them in their new spot. But taking steps towards housing goal achievement can be really complex, especially when individuals have limited income. And when costs like application fees, deposits, or first and last month's rent and others pop up, in the past, FCS supportive housing case managers would typically have to put their boots on the ground with an enrollee to identify resources that may be able to help cover those costs when an enrollee wasn't able to cover them on their own. But that's changed kind of recently. During a recent legislative session, FCS received funding to cover housing-related costs for enrollees, especially folks that might be transitioning out of inpatient facilities. And the FCS team was really thrilled to launch the TAP program in May of 2022. The TAP program, or Transition Assistance Program, is a flexible funding resource that aims to lower or remove financial barriers to housing stability for FCS supportive housing enrollees. And to access the fund, a person must be enrolled in FCS eligible Medicaid and FCS supportive housing services through their FCS supportive housing provider. So AmeriGroup manages that fund, and FCS provider submits funding requests to AmeriGroup to access TAP on behalf of that enrollee. Really, TAP aims to support housing goal achievement for folks that are enrolled in the program. So it covers housing-related costs like fees for ID documents that are oftentimes needed when applying for a new apartment, application fees, move-in costs like first and last month's rent, and more. And while no ongoing rents can be paid, TAP can offer several months of interim rent payments. TAP may also cover certain home modifications when approved by a landlord, certain home essential and sustainability items once moving into a unit, some past due rent charges if those pop up, and other housing related costs via what we like to call the exception to policy process, or ETP process. TAP maxes out at $5,000 per person per year, and enrollees authorized to spend up to $5,000 on housing related items on a rolling basis. And so what that means is that if a person spends $4,000 today, they have $1,000 to spend for the remainder of the year if needed. And again, that's for housing related costs. And a year from now, that $4,000 that was spent today would fall off their record exactly a year from today, so that they can access a full $5,000 again if needed. But with that, I am going to take a step back and pass it on to, I believe, Whitney Joy. Or am I past it? I'm sorry. It could be, I forget.
Danny.
Danny. Hi, Danny.
Yes, we mix it up for this presentation for you. Yeah, well, thank you everyone for the opportunity to chat with you a little bit about our some of our programs that we offer here in the Office of Apple Health and Homes and Permanent Supportive Housing. Today, I'm going to mainly focus on two programs that have been around for a while. You may be familiar with them, which is the Community Behavioral health rental assistance and the HUD 811 program. But I do want to also just give a nod to some new programs that we have that we're working on standing up, the Apple Health and Homes, as well as a couple of other programs. So I'm going to post a link in the chat to our I don't know what just happened in the chat. I apologize. To our Office of Apple and Health Office. Oh my goodness. Time for a deep breath. To our Office of Apple Health and Homes webpage, where you can follow these programs as they unravel, roll out here in the state. There's also links on there to the two programs that we'll be talking to you about today. So the programs that we are talking about today are both long-term or permanent subsidies, which means they're meant to be serving folks that are going to need subsidized housing for a long period of time. And they partner very strongly with our regional ASOs, with DBHR, the FCS program, and with ALTA Housing and Services program. Can I have the next slide, please? All right, so community behavioral health rental assistance. Again, probably many of you have heard about this program and are familiar. So I'll just quickly go through the background and some of the eligibility and what the program has to offer, and then give a little report out on who CBRA served last year. So originally, CBRA started with a $2 million grant from the legislature and as a pilot across 8 behavioral health regions. It was paired with HARPS teams and some housing providers to offer permanent or long-term subsidies for folks with behavioral health conditions. And as a result of the 2021 legislative session, there was an expansion in funding that allowed us to roll this out across all the counties in Washington state. And the way that this is structured is that Department of Commerce contracts with the Behavioral Health Administrative Service Organization in each of the behavioral health regions across the state, and they are responsible for contracting and finding providers, CBRA providers in each county within their region. And I would say that since 2021, CBRA providers and leads at the ASO have been working tirelessly to stand up this program. And at this point in time, many counties have obligated their funding. Their caseloads are full with clients, which we knew would happen. And so there has been a bit of a change in momentum, I should say, between having this large award that we're rolling out to now having full caseloads. CBRA is specifically designed for individuals who are likely to need subsidy for long-term or permanently for the rest of their lives, or as long as they need it. And it was also designed to be as flexible as possible. So to meet the needs, and specifically to meet the needs within each community, to be able to pair with the resources that are already there to support folks in this way. It can be used, the main goal is for it to be used as a long-term subsidy for folks that need it. There's a shortage, as we all know, of long-term subsidies available, but it also can be used in what we call a bridge, which I'm learning that is a very, that word is used across different programs and different systems. And it means different things. So I am thinking that we probably need to change that. The idea here with CBRA is that as a bridge, the participant still has a need for long-term subsidy, but CBRA can be used on a short-term basis in that case to help get somebody from where they're currently at, maybe in unstable housing, or maybe they're homeless, to a permanent subsidy to another permanent subsidy other than CBRA that they can have as long as they need it. So there's 2 different ways that CBRA is typically used, but really the idea is that it is still focused on that population that needs subsidy for the long term. So for example, maybe an individual is discharging from an inpatient psychiatric facility in the community, and they're up on the Section 8 voucher list. They could potentially receive CBRA to move into a place or to get some rent or to maybe be in a hotel or motel until they could utilize their Section 8 voucher. There's a lot of different scenarios. What it's not, I think that the point here is that it's not a rapid rehousing, and it's really not meant for folks who maybe just need 1 or 2 months of rent paid and then they can take over the rent on their own. It's really focused on folks that need a longer term subsidy. Main purpose is to facilitate stable long-term housing solutions for individuals that are discharging or needing to discharge from inpatient psychiatric facilities. So it's really important. That's the main kind of legislative intent behind the funding. But there's also an emphasis on individuals that were recently discharged or who might be at greater risk of being readmitted due to unstable housing. This is the priority population for CBRA, but I also want to be clear that an individual does not have to be part of that priority population to receive CBRA. It looks different in every county depending on the need of folks to discharge to that county. So anyone that meets the eligibility criteria could potentially receive a subsidy. But as funding is being utilized and committed, and there are wait lists forming, the individuals who meet the priority population will be prioritized when there's openings in the program. So there are 4 main eligibility criteria for CBRA. There is an income eligibility, 50% of the area median income for the household. There is an adult member of the household has to have a documented behavioral health condition. That same individual needs to be eligible for a long-term supportive services program that's offering some type of pre-tenancy and tenancy sustaining services. And the individual or the household needs to be identified as having a need for long-term subsidy and not having other resources that are more suitable for that. So behavioral health condition for sake of CBRA eligibility is a mental health condition or a substance use disorder that impairs an individual's capacity to address normal activities of daily living and is expected to be of long duration. There are a lot of different ways that can be documented, and you can learn more in our guidelines that are on our webpage. Last year, there were about 50% of the funding was expended as we were trying to integrate CBRA in this big funding increase and roll it out across the state. And 733 individuals were served with our CBRA subsidy. About 400 of those were served for a period of over 6 months within the reporting period. So we would consider those long-term subsidies, and about half were, a little bit less than half were served for less than that period of time. Doesn't mean that they didn't go on to, they didn't stay on the program and go on to become long-term subsidy participants. One of the biggest challenges as we were rolling out the program was that most providers were really struggling with finding stable housing options, affordable housing for their participants. No surprise to everybody in this room. So really, really quickly, CBRA provides housing. CBRA funds securing housing, funds rents and move-ins, and there are a few special circumstances that are allowable costs for this program. What it does not provide is any type of funding for case management, care coordination, maintenance, etc. So CBRA staff are very limited to providing, the only things that they really provide along that line is a limited housing search assistance, and then they can bill for activities to assist clients with recertification. So this is a really important part of the CBRA program, is that it depends on supportive service providers and CBRA providers to work really closely together with with them between themselves and with the client to help the clients locate housing options, to provide stabilization and tenancy maintaining services. And also, CBER providers depend on the service providers to notify them when a client is no longer eligible for their services or they're not receiving services. So, and we're working this year to really delve into what does it look like to work closer together? How can CBER providers engage better with the services providers, and etc. And next slide, please. Or actually, could you go 2 slides, please? And just again, really quickly, for those that may not be aware, making a referral to CBRA is, excuse me, you can make a referral to CBRA. The first step to do that is to visit our webpage, and I'm going to put that link here in the chat in just a moment. There are 2 ways that you can find out whether a CBER provider is currently accepting referrals before you reach out. So we're hoping that saves you a little bit of time. On our webpage, you'll see this on the left. There's a provider map. When you open up our webpage, you can click on any of those icons and it will bring up some information. You can scroll down and it will tell you if they're accepting referrals. And then on the right-hand side, at the top of our webpage, there's a red bar. And if you click the link in that, you can get that information in a list format with all the CBER providers. So hopefully that will be helpful. Can I have the next slide, please? I'm going to move on and talk about our HUD 811 program. This program is also a long-term subsidy program that offers project-based subsidized units across Washington State for individuals who have disabilities who are non-elderly. These are individuals who are between the ages of 18 and 61 years old at the time that they move into the unit, so at lease signing. The units, the HUD subsidized units, are located in multifamily housing projects where 25% or less of the units in that project are dedicated to folks who have a disabling condition. Doesn't mean there can't be greater than that number of units that have that population, but only 25% or less can be dedicated to the population to try to encourage or to discourage segregation. There are studio, 1-bedroom, and 2-bedroom units available, and currently we have 132 units in 7 counties, including King, oh my goodness, now I'm going to space, King, Spokane, I believe we have Benton County, and a few others sprinkled around the states. And we just received another award during the pandemic from HUD, so we're working to add at least an additional 134 units across the state. To be eligible for this program, individuals have to be between the age of 18 to 61 years old at the time of lease signing, extremely low incomes, that would be at or below 30% of the area median income, and receiving or eligible to receive the in-home long-term care services and supports that are paid by Medicaid. And in just a minute, you're going to hear from Whitney Joy, who will talk a little bit about the functional and financial needs to qualify for ALTA services, which the significance of this, of that is that we have a partnership with that team. And so it really is clients that are referred to HUD 811 units come from the ALTA and Home and Community Services team. So they are the ones that do the eligibility check. They qualify tenants for this program. So we'll learn more about that in just a moment. Commerce contracts directly with property owners at these multifamily housing projects to provide and to maintain these units across the state so they're stable. And I think that is the overview for 811 units. Do I have any more slides on there, Kimberly? Okay.
For today. Yeah.
That's it.
Thanks, Danny. Hi, everyone. Whitney Joy. I am going to talk about a few resources through home and community services. So just wanted to throw it out there that these resources are specific to individuals who've been found functionally and financially eligible for home and community services, which is our long-term care system in Washington State. Under that functional need, it says nursing facility level of care. That's not accurate. I forgot to delete that one. The housing resources I'm going to speak about, you don't need to meet nursing facility level of care. We have a kind of like base level program that somebody could be eligible for called Medicaid personal care. And somebody eligible for that program is also eligible for housing resources. So to be eligible for long-term care through home and community services, an individual must qualify financially, functionally. So when they apply, a public benefits specialist will review their income and resources to ensure the client is income resource eligible. Some clients who have a bit higher income may still be able to qualify. They just might need to pay a bit for the care that they receive through home and community services. People open on home and community services are eligible for Medicaid. So there are some individuals who are receiving Medicare, maybe paying for their medication. And then even if, so then if they make a little more and they have to pay toward their level of care, since they're open on Medicaid, it actually might be a cost savings overall for them. So the case manager could talk to the person about that. So basically just mentioning that, because if somebody's hesitant about potentially having to pay for their level of care, pay for their services, it might actually be a cost savings overall. So I'd still encourage that person to apply and just see what the options are. And so while that financial eligibility is being determined, a case manager is also working to determine if the person is functionally eligible. Because we offer long-term services and supports, a client must qualify based on their needs with their activities of daily living, or ADLs. So these are things like their physical ability to eat, bathe, mobility, medication management. If they need assistance with medication management, that's what that assessment is really looking at. And it's determined through an extensive assessment completed with the client. But if somebody is assisting that individual apply for services, they can certainly sit in. It's called a care assessment. They could certainly sit in on the care assessment and kind of help provide collateral contact information to support the case manager getting a full picture of where the client is at. And then eligibility for home and community services is reviewed on an annual basis, both the functional assessment and financial assessment. Next slide. And I'll also actually just make note that when somebody is open on long-term care services, they are open for the period of a year because it's reviewed annually. So they're also continuously opened on Medicaid for that period of a year. Within Washington's behavioral health system, people can be on and off Medicaid throughout the course of the year. Our long-term care system is a little different. So when somebody is opened on long-term care services, that Medicaid is consistently active for the course of the year that they are opened on those services. So Home and Community Services has a housing team that I'm on, and we work to create, grow, and administer housing resources and quality supportive housing services for HCS eligible clients statewide. Our team has partnered with various public housing authorities throughout Washington to secure direct access to specific federal vouchers, such as non-elderly disabled and mainstream vouchers. And as new or additional federal vouchers get issued, we build upon these established relationships to secure access to these additional vouchers. So for example, recently there was the creation of the emergency housing voucher. So we're able to use our established partnerships to get access to some of those vouchers. And we're currently pursuing some opportunities with the newest stability voucher that's been issued through HUD. And then, as Danny noted, we also partner with the Department of Commerce to secure direct access to various 811 project based vouchers throughout Washington. And we have brochures on each of the resources in these little houses on our website. And at the end of this PowerPoint, there is a link to our website, but I'll also put that in the chat. It just gives you a bit more information than you'll find here. And I just wanted to note this because I realize there's a sense that Home and Community Services is the division to reach out to when a client wants to live in a residential setting, like an adult family home or assisted living facility, or if there's a thought that the person needs a skilled nursing facility. So I wanted to note that Home and Community Services does have a robust package of services to support someone living independently to age in place. I think oftentimes as someone needs support maintaining their housing, there are opportunities to be connecting with Home and Community Services earlier to bring that support in and not waiting to the point at which the thought is that somebody needs a higher level of care. So there are resources that could be put into place much earlier to support their continued living in independent housing. And then we also have these dedicated affordable housing resources. We have funds for transitioning into independent housing, things like paying for deposits, move-in funds, basic furniture, household items. I forgot to add a slide about these resources, but they are there and available for all Home and Community Service clients who need access to those supports. And then we also have these various independent housing resources. I'm going to speak about the ALTA subsidy, which is a state-funded subsidy we administer statewide in a couple of slides from now. And Danny spoke about the 811 project-based vouchers. I did want to note, I think people are aware mostly of housing choice vouchers, but HUD does provide a variety of specialty vouchers, and they have been increasing their funding and allocation of these vouchers over the past few years. So ALTA has a number of non-elderly disabled vouchers. They have different categories. We have several non-elderly disabled 2 or NED 2 vouchers, which are specific for people aged 18 to 61 who are currently residing in an institutional setting, which would be a skilled nursing facility or our state psychiatric hospitals, or there are a few other qualified institutional settings scattered throughout Washington. So people currently in those settings are actually eligible for NED 2 vouchers. They need to remain in the setting until the voucher is actually issued, and then they could discharge and have a housing search taking place at that point, but they need the voucher issued while they're in the qualified institutional setting. And then ALTA, or Home and Community Services, has support services that I'll talk about in a moment through supportive housing or community choice guides, which are essentially housing specialists that we have available to support someone in their housing search using these vouchers. And then HUD, over the past few years, have been issuing another category of NED vouchers that are referred to as mainstream vouchers. And so these, somebody does not need to be in an institutional setting necessarily. It's a more broad definition. So they could be in an institutional setting, or they could be at risk of institutional setting, or experiencing homelessness. So there are a number of housing authorities throughout Washington who administer mainstream vouchers, and HCS also has access to a number of these vouchers. Currently in Southwest Washington, we have, I think, about 10 vouchers currently available for our NED 2s specifically. So if people are in institutional settings that you're working with and you have interest in getting more information about the NED 2 vouchers, please feel free to reach out. You do not actually need to be eligible for Home and Community Services to utilize these vouchers. And then finally, our emergency rental assistance program is available. It's a state-funded resource available to support someone who is at risk, who is housed and at risk of an eviction. If they, for whatever reason, got behind on their rent and they cannot afford to pay the amount they're behind on, but they can pay their portion of rent moving forward through Home and Community Services, we do have funds to pay emergency rental assistance to support that person in stabilizing in their home. I see in the chat asking, unfortunately, for the purposes of the HUD vouchers, jail is not considered as part of an institutional setting for these NED vouchers. Next slide, please. And then there are supportive housing services available through Home and Community Services. We partner with the Healthcare Authority on foundational community supports. We have dedicated staff who work statewide who support Home and Community Services case managers and area agency aging or AAA case managers in verifying eligibility for FCS and making referrals directly to AmeriGroup and working with FCS supportive housing contracted providers, providing technical assistance and helping to get some referrals to those providers as well. And then our Governor's Opportunity for Supportive Housing, or GOSH, is a supportive housing resource that HCS directly administers, directly contracts with statewide. It started in January of 2017. We've served 1,000 people, almost 1,000 people through GOSH. And currently have almost 500 active participants, and we've housed 400 individuals through our state subsidy through GOSH. So this is a resource for people on Home and Community Services who are discharging or diverting from Eastern or Western State Hospital. Unfortunately, at the present point in time, we are currently focused on people discharging from Eastern or Western. We've been very successful in gathering referrals for GOSH, and we have overspent our budget for the 21-23 fiscal year. So we had to take a hold on our diversion referrals, and we're focused on referrals for those discharging Eastern and Western, and hoping when ledge session ends, we will have more information about our budget for the next biennium and hoping to start diversion referrals back up. And so, as I mentioned, there's also a subsidy that comes with the supportive housing service for GOSH. If you go to the next slide, I will talk a bit more about that. So the state-funded ALTSA subsidy program was launched in 2012 as part of the federal Money Follows the Person Medicaid demonstration, which in Washington we call Roads to Community Living. We modeled our state subsidy off the federal tenant-based housing choice voucher program because our state subsidy is intended to support individuals moving from institutional settings, skilled nursing facilities, or state hospitals, or diverting from them to community settings, to independent housing. And the subsidy is available to assist someone quickly transition out of the institutional setting into housing while they are looking for permanent affordable housing, getting onto wait lists, maintaining their place on that wait list. I refer to our subsidy as temporary but not time limited. We understand that in some areas, I live in Seattle, somebody may be on a wait list for affordable housing or a housing choice voucher if they are able to get onto that wait list, or senior housing or some other tax credit property for 5, 6, 7 years. So we understand that some people might be on our subsidy longer term, but we work with our providers to support that individual in pursuing more permanent options for housing. And then we pay the subsidy in the interim. And the reason we modeled our subsidy off a housing choice voucher is because the intent is for that individual not to have to move, but to be able to get on to a wait list for a housing choice voucher as the public housing authorities open up and have lotteries, so that when they are able to access that voucher, they can just kind of switch the funding source for their apartment and not actually have to move out of their apartment and find new housing. We have Spokane Housing Authority administer the voucher statewide. A number of years ago, our housing program managers used to administer the subsidy directly and enter into contracts with every landlord that was accepting the subsidy. Every client moving into an apartment, our team would directly contract with the landlord to be able to get the landlord paid each month. And the program has grown significantly. We've housed nearly 1,000 people on our state subsidy over the years. So in 2017, we 2016, 2017, we ended up contracting with Spokane Housing Authority, so they actually administer our subsidy statewide. And we do have Spokane Housing Authority entered into interlocal agreements with every public housing authority across Washington. So the local housing authority actually does the housing quality standards inspection, which is required to take place and for that apartment to pass an HQS inspection prior to the person moving in, just so that we can ensure that the apartment is safe for that individual to live in. And you can go to the next slide. So we originally made this slide when Amazon's the Rings of Power show was airing. So that's why we have Fellowship of Housing. Housing and resources and services to support housing can be confusing and frustrating, especially with the scarcity. So we wanted to acknowledge that. And we also want to highlight that partnering, pairing, braiding, as we'll talk about in the next slide, is critical to stretching out the resources we have access to and working in partnership to truly create the type and intensity of tailored services and supports the individual needs and wants to sustain their independent housing for as long as possible. Working in partnership and weaving these together or braiding these together can really help build that cross-sector system of care that we're looking for across our state administration and across at the community level as well. So we wanted to kind of touch on these different resources that are available through the Healthcare Authority, Commerce, and ALTSA, just to get a better understanding of some additional resources you may not have been aware of, and some ways maybe that they could kind of fold together or braid. And if you go to the next slide, we have some examples there. And so this is, again, some examples for the braiding of the subsidies together. So we, for instance, if there's an individual, a low-income individual who has behavioral health needs and activity of daily living needs, which is happens very frequently because people aren't kind of in buckets, right? We're complex individuals. We have a lot of needs. That individual could be connected to the CBRA voucher because of their behavioral health need. So they could have a CBRA housing subsidy, also be enrolled in home and community services and get their transition funds to move into that unit covered through through home and community services. So their application fee, maybe a background check to support the housing search process, move-in funds, basic furniture and household items, and then also have a caregiver to help support them sustain their housing as they're using the CBRA subsidy to assist with rent. Another example we threw out was if somebody is being discharged from one of our state hospitals, they could be connected to HARPS in advance of discharge from the state hospital to have some in-reach and services being provided, as well as their HARP subsidy to support kind of that transition out of the state hospital. Once they're out and their Medicaid is reactivated, they could be transitioned over to foundational community supports to have the supportive housing benefit paid through Medicaid, because Medicaid is not accessible when somebody is in the state hospital. And then maybe also be connected to a CBRA subsidy for ongoing rental assistance, or maybe while they're at the state hospital, they could be connected to a NED2 voucher to have a permanent funding source for their housing, or GOSH, or maybe there's an 811 unit open that they could transition into, and the HARPS team could assist with that process. So there are different ways that we can kind of plug in these different resources and braid them together to maximize the funding opportunity, but also create a broader system of care for that individual. I don't know if anybody else wanted to chime in there, just taking a look at some of these questions.
Looks like Eric has a question surrounding what resources someone might be able to access when discharging from behavioral health facility, or a behavioral health facility who's been involuntarily committed. And I think that Kimberly has been working on something, or worked on something a bit ago, a discharge planners toolkit that I think we were going to be mentioning here in a few slides, Eric. So if you can hold tight on that, I think that might be a really great tool for you to explore. But with that, just to kind of go back to braiding, I think that link, once shared, if all people want to explore that discharge planners toolkit, you can really gain insight into what's out there, and then also kind of be thinking about how you can braid and sequence and stack some of these resources in a way that fully supports the enrollee in whatever experience they're having trying to obtain housing.
And I do just want to add one thing. I mentioned this when I started talking about long-term services and supports, but I just want to clarify. The housing resources I'm referring to are for people who want to live independently out in the community with a lease. And then the long-term care system also has residential setting options, adult family homes, assisted living facilities. We have some specialized residential settings for people with behavioral health needs, which are enhanced service facility, or ESF, is our kind of highest level of care of residential housing. The residential housing side of things is different than our in-home independent housing side. And residential housing, an individual does not have a lease. They pay a large portion of their income toward the cost of their care within that facility. And they're getting your services and needs met within that residential setting. So just wanted to clarify, the resources I was talking about really were for independent housing for individuals wanting to live out in the community in their own apartment with a lease.
I also want to just mention that, we recognize that sometimes braiding funding can be really complicated, right? There's a lot of different programs, federal and state programs, different regulations. And this, especially with these programs, there really has been a partnership to work together to see what we can do to streamline as much as possible some of the large requirements that that we're hoping will help with when you're braiding funding. So that might look like, oh my goodness, what you all have an example of maybe one of the things that we've aligned recently. I'm thinking about my brain is trying to blank, y'all. But I'm thinking about conversations that we've had about like fair market rent, right? And although our programs may have a different stance on whether they can or cannot exceed the fair market rent, we all have tried to align our practices with making exceptions to that, so that we're considering what does it look like when someone moves into a Section 8 voucher or another federal program that's out that has different regulations, but then also what type of flexibility are we sharing within our programs, so that when you access FCS TAP to help pay move-in expenses and then maybe transfer a participant, a client into GOSH or into SEBRA, that you're not having to reevaluate what that looks like. So we are also always open to hearing challenging points for you all. So if you're coming across things when you're trying to braid resources that are not aligning well, we would love to hear about those so that we can keep having that conversation.
Great. Thank you for that, Danny. I think Kimberly's going to be talking about how to unlock the potential in your community.
Yeah, so one of the things that we like to talk about when we're doing supportive housing services, and one of the reasons why we brought up the partnership between us, is that it's really important that we do have partnerships in our community in order to access a lot of these programs and access resources for your folks in your community, is to think about all the different places that resources exist, including the funding streams that your folks need to access, right? And so I always tell supportive housing providers, what are the potential places that you could be creating partnerships in your community? What are the potential agencies or places that have some of these things that we want to go out and create partnerships in? So we put a bunch of places here as just ideas, places that when we were doing direct service are places that we knew you could go to create resources, not just funding streams, but different resources that your folks may need to access in order to have ability to create whether it's natural partnerships, places to access things that'll help them sustain housing, ways to become kind of self-sufficient. And so these are all different ways to do that, whether it be the ALTA providers for different programs that they could access, whether it's, just places in the community where they can become self-sufficient. Maybe it's the resources that they need to be able to gain benefits, get connected to resources to help them get their kids back, all those things, right? So we just wanted to list all of these different ideas, and I want you to think about it, tap into your communities and think about where your partnerships could be created and think about how you can do that. So I just like to give ideas and then think about that. I always say, that's a great team building activity to think about all the different places in your community. And I always say, think about the ones that you're not really thinking about. Ask your participants, hey, where are some of the things that you need and where can we access that? Where have you gone to create partnerships, or where have you gone to get resources that maybe I'm not thinking about? A lot of times what I learned from my participants helped me with other participants down the road. I never thought about going there to get that, right? So do that as a team building activity, and you can create that virtual binder of resources and ways to get more resources for your folks and ways to get them self-sufficient and supporting themselves and helping us support others. One of the things also with that is helping generate and maintain those partnerships. And so by doing that, I like to say it doesn't have to just be leadership that's doing this work. So it can be anyone on a team that's going out and thinking about what partnerships we want to create. So think about, as an FCS provider, I'm always like, hey, one of the great partnerships that can exist could be the housing authorities. They want case management. They don't do case management on the level we do. Could we go out and create a partnership with those folks? Maybe it's the CAP agency, the Community Action Council. They have some subsidies that maybe we don't have access to. Maybe we need to go meet with them and see if we can create a partnership to be able to serve our folks together. We're all serving the same people, right? And so what can we do to create that partnership by going to our leadership and saying, hey, I have this idea, right? So you have to get that buy-in from your leadership sometimes. It doesn't necessarily have to be them doing it. So first off, go talk to them. Say, this is my idea. Who should be doing that, right? Decide what kind of partnership you want. Identify who those people might be. It might be one agency. Maybe it's 3 people that need to come together to do this work, right? Engage those partners, whether it's an in-person meeting, maybe it's a series of things. I used to go to stakeholder meetings in my community, and that's where I did a lot of this work, right? I'd go to those stakeholder meetings, those homeless task force meetings, and really talk to folks about, hey, I have these ideas. I want to do this. What do you think? You want to do that with me, right? And some of that work would happen just organically in some of those venues as well. And then go back to your leadership and say, can we do this? Who should be the point person? These are the goals and outcomes I hope to reach with this. And one of the things I like to say is keep it simple. Keep it simple. It doesn't have to be this big process. Sometimes we overthink it so much that it doesn't work, right? And so we hear all the time how it's hard to do that coordination of care across communities. And it's because a lot of times we're making it hard. We're making it harder than it has to be. And so try to keep it simple so that we can make sure that this can happen and that we can work together as a community. It takes a village to do this work. And if we keep it simple and make it easy for us to do it together, it'll happen and it'll be this organic thing that just exists, right? That we keep doing as long as we maintain it. Having those regular check-ins, making sure that we're communicating well, that we're working together, that we're doing that wraparound support by having a time, being intentional about those check-ins, making sure that we don't let things fall through the cracks, right? Just like we would check in with our participants, we'd want to check in with our partners that are doing the work together to make sure, hey, how are things going? How is this working for you? Is there things that we could smooth out the processes to make it easier for both agencies to make this happen for our participants, right? This is really good work. And the more we do the work up front to make these partnerships happen, the easier it is down the road for you as an agency, as a team, and also for your participants. And that's really what it's about, is serving the folks well. So coming up with assessments, referrals, maybe it's an MOU or kind of release that makes it easy for these to work, and just thinking about it. All levels are powerful. Again, this does not have to be leadership. It's an agency decision who gets to do this work, but case managers can go out and do this, right? And so thinking about, don't be afraid to bring up an idea. Don't be afraid to say, I want to this partnership happen, and bring it to your team and say, who's the right person to do this? Can I do this? Can I go out and make this happen, and make it happen, right? It's really exciting to get these things happening, and it will make things better for the folks you're serving in your communities. All right.
Thank you, Kimberly. I'm going to touch on a really exciting new initiative that's coming down the pike right now. It's in the midst of being developed, and implementation will be coming soon. But during the 2022 legislative session, Engrossed Substitute House Bill 1866 was passed. And this bill directs the Healthcare Authority, the Department of Commerce, and the Department of Social and Health Services to collaborate on the implementation of Apple Health and Homes. And as part of this bill, FCS supportive housing services are paired with bricks and mortar housing by way of project-based and tenant-based rental assistance for a certain subset of FCS supportive housing enrollees. For this program, Apple Health and Homes, AmeriGroup will play the role of the coordinating entity, which is the current FCS program's third-party administrator. They'll be doing a lot of what they already do, which is authorizing FCS supportive housing services for Apple Health and Homes eligible individuals. And they'll also be working on coordinating the housing piece as well, in collaboration with the Department of Commerce's third-party administrator for the rental assistance portion of the program, who's known as H2 Consulting. They will be administering the rental assistance portion of this program. And so FCS supportive housing service providers will play a really critical role in linking participants with this benefit by helping enrollees identify and obtain housing of their choice, as well as maintaining that housing of their choice. But this housing stock will be really specific to the Apple Health and Homes program. And so staff at Commerce's Office of Apple Health and Homes and Permanent Supportive Housing are working with us here at HCA and Whitney Joy at DSHS to design this program. And there will be more information available in the near future regarding how Apple Health and Homes will work. And I'm going to kick it back over to Kimberly Castle so she can talk about some other exciting stuff we have going on.
Thanks, Scott. So just wanted to mention a few other things that are happening here at HCA. So one of them got launched last year. Or actually it got launched at the beginning of this year. It's been going on since last year. We were testing it. It's the Discharge Planners Toolkit. It was something that Scott just mentioned. We're really excited about this work. It's been a dream that we've been dreaming up for a while. This is a great toolkit that's designed to help discharge planners get folks connected to housing resources and get people connected to housing resources before they're getting discharged from inpatient settings. So again, a lot of times discharge planners are not familiar with the housing system. This is a lot of the work that we're doing here, is just making sure people understand the complexity of our system, and discharge planners don't get trained on that. They're not familiar with what resources are necessarily out there. And so we wanted to create a way for people to get connected to these resources through that discharge process. And so the Discharge Planners Toolkit was designed to get folks connected to those programs that exist and have that direct connection to those resources. And it's not just for discharge planners, that's what we created it for, but we have case managers using it. We have lots of different folks utilizing it. Right now, it's mostly our state programs through ALSA, Commerce, and DBHR that exist there. We have subsidies connected in there. We're going to be having youth programs connected in there as well soon. And so we're really excited about the potential for this. It's really in its infancy stage still. We're doing a lot of work to fine tune it, and it'll be an ongoing living, breathing document. So as things change and evolve in the system, so will the Discharge Planners Toolkit. We'll make sure you have the link to that toolkit so that you can access it, but it is on the HCA website. It's also on Pathways to Housing. And so please, if you are having trouble accessing it, reach out and we'll make sure you get it, but it will be also in the follow-up for this webinar. Another thing we're working on here at DBHR is a master leasing toolkit. This is a brand new project. We've just barely started to kick off the work on this, but really wanted to make sure that agencies had some support in talking about master leasing, as it's another option for expanding the ability to house folks, right? And so we want to make sure that everyone has full choice in housing options, and master leasing is another one of those options on that full menu of options of housing. And so master leasing can have some complexities. We wanted agencies to truly have have that ability to know kind of the process and how to do that. And so we want to be able to support that work. And so we're going to work on that toolkit so that folks can really get a little bit more support through that process. And then I have the pleasure of working on a new project connected through the FCS program called Glide Path. And this is a really great enhancement to the supported employment benefit. It's actually connected another partnership we have with Department of Commerce. You can see that we're very, very big partners with our other government agencies. So we are offering some additional rental assistance. So HEN got some additional funds through Commerce to offer an additional up to 9 months of additional rental assistance for folks that are falling off of HEN due to increase of income or other eligibility criteria, who are also enrolled in foundational community supported employment. So these are folks who are going back to work, increasing their income, but also need that additional rental assistance to kind of stabilize as they become more self-sufficient. So not only will they be able to access some rental assistance to go through that as they're going into that self-sufficiency process, but HCA is also able to contract with some agencies to provide some support in hiring benefit planner, another supported employment specialist, and then also some flex funds to support those individuals in going back to work, whether it be bus passes, certifications, work clothes, whatever that may be. And so we're really excited to be launching this program this year. And I can't wait to give more information about what that'll look like. And so we're really excited to be able to support the supported employment side of the house also, because we know supported employment and supportive housing really go hand in hand. And we want those folks to have support in going back to work and doing those things while still accessing their benefits, right? We don't want them to think they can't go back to work because they don't want to lose their benefits. So we want to support that with that benefits planning, having support in that supported employment side of the house, and also if they need to, accessing supportive housing services if they're not already. So that's really exciting. And I'm going to pass it over to Danny to talk about the Permanent Supportive Housing Advisory Council.
Yeah, so we have a lot of new initiatives kind of coming up in the Office of Apple Health and Homes. As Kimberly noted, there's several that we're working on together. And Scott, I guess, also noted that the PSH Advisory Council is something we're really excited about and really proud of. They met for the first time. The PSH Advisory Council is meant to provide some structure and some information and guidance, I guess, some advice toward the development of what does permanent supportive housing really look like for the state of Washington. So a lot of exploration happening in that space. What's really exciting about this council is there is a very diverse group of members in that space. So we have individuals with lived experience, individuals with developmental disabilities. We have folks that are operating permanent supportive housing and that own those actual projects. We've got service providers, housing authorities, etc. So it's a large advisory council with a lot of different perspectives all at the table to really delve in and explore what is permanent supportive housing. We also have one other thing that I forgot to add to the slides that I just wanted to give a brief mention to is we are also working on developing an additional program. We're calling it 1277. That's the legislative bill number that was associated with the funding. And this is really to work with counties across the state of Washington to develop and expand their permanent supportive housing. So there's a lot, that's the gist of where we're at right now in that process, and there's more to come on that, but I just wanted to put that out there as well. And Whitney Joy.
Oh yeah, nothing. We have some hopes and dreams for expanding our independent housing opportunities through Home and Community Services, but we are anxiously awaiting ledge session to end to see where we might land. We're hoping right now our state subsidy really is focused on people exiting institutional settings. We're hoping to expand our eligibility a bit broader on that. We, over the past year and a half, have been providing, paying for basically motel stays for clients of ours who had a housing voucher or subsidy issued and they were in search and had nowhere to live while they were searching for housing. So we're hoping to be able to get some additional funds to continue to support that program. And then we also are doing work with, we call it housing capacity, where we are working with developers for new affordable housing, permanent supportive housing buildings, or remodeled to be able to actually pay for some units within those buildings through our subsidy to be able to access physical, tangible housing, because just the rent assistance isn't the actual housing, kind of what Kimberly was referring to related to the master leasing toolkit. So we're hoping to continue to expand that work as well to grow our access to tangible housing. And I did see in the chat, there was a question about HUD 811 project, including GOSH participants. There are some GOSH clients who end up, GOSH clients have access to our state funded subsidy, but if there is a federal voucher that is accessible, that would be the option to go. So if there is an 811 unit open in an area where they want to live and they would like to live in that unit, they absolutely can move into that project and still be receiving their GOSH supportive housing services. Right now, there is a building in Pasco, Skillstead Haven, that also has is working to lease up 10 811 units and 10 also subsidy units within that building. So there are a number of clients we're looking at for that building, either side 811 or state subsidy. And I think that's it. There's a question about the toolkit.
Yeah, Eric, I think Kimberly is pulling up that link for you right now, just so you know, and it will go out in the email. We do realize that there was a old link involved in some of the press release that you may have seen. So.
Sorry, I just sent that to Melody. I apologize, Melody, if you get that direct message. Here you go. There's the toolkit. Hopefully, oh, I don't know if it came up as a link.
Nope.
Darn it. Not sure why it's not coming up. If you guys don't get it as a link, I will make sure that it's sent in the email. I apologize. Yeah, some folks took the original link and put it on their web page. And so then when we launched it live on our HCA webpage, some of the folks didn't take the new link and put it there. So I'll make sure you have the correct link. It is on our HCA FCS resource page and also on Pathways to Housing. But I'll make sure you do have that. I apologize.
Can we invite any questions that folks may have at this point, or comments, or if anyone wants to share any experiences with the system that we've been talking about, or the systems, we'd love to hear.
I have one, since nobody seems to be saying anything. Can you hear me? This is Eric Eisenberg. You can? Okay, good.
Yeah, we can hear you.
So nice to meet you all. So I would say one of the hangups that Lewis County seems to have with citing facilities for housing more generally, not just these types of housing, is that there are many opportunities for capital funding right now, but what we don't have is a network of sophisticated nonprofits that could actually manage facilities like this or provide the services necessary to a facility that was of any substantial size. Is there any good way that you know of to start trying to figure out how to network with existing nonprofits that would have the capacity and might have some desire to locate in the area?
That is,
Go ahead, sorry.
I should have waited 1 second longer. No. Eric, I think that's a great question. And I think that there are opportunities to do that. And we've seen that demonstrated throughout different communities across the state in different ways, right? At different levels. I don't know that there's like a specific toolkit or resources available right now. I know that in the Office of Apple Health and Homes, we've been kind of mulling over and talking about what does that look like to help support that more across the state. How do we connect providers with other providers who have done that? I think that I don't know that there's anything at the state level that we have specifically prepared. I don't know if anybody else wants to jump in, but I definitely will take a note down. And as you know, I'm happy to pass on names of other communities that have been successful about doing that, and maybe try to connect you and see if there's some best practices and things that they can pass along. But we've been hearing that's starting to kind of come up more and more, is that those partnerships are critical for agencies, especially those that don't have a lot of resources, to be able to start accessing the capital funds to get your communities the type of housing that you need. So yeah, thank you for bringing that up.
So I can give a specific example just because I think that might help you as you're reaching out. So certainly in the Centralia and Chehalis area, those are fairly small cities anyway, but there are some groups that can do this type of work. But for example, in Morton, which is even smaller, it has, I don't know, there's less than 1,000 people as a city. It wouldn't even be allowed to be a city currently if it were trying to incorporate. They have a space that opened up that is an out of business fraternal organization space. It's large. They have a homeless population. They have a mental health provider that serves that population, but they don't have any nonprofit that's situated to run housing out of it. It seems like there might be many people through your services or just generally eligible for low-income housing that could benefit from a housing thing there, but there's no one with an outpost even close enough to kind of spring there. So that's the kind of issue that you'll find in the rural areas, is a lack of human capital, lack of human capacity to actually take on a project of that magnitude.
I love that. Thank you for that feedback. I agree. I've been hearing that as we've rolled out CBRA, just in general, and that's not capital, but yeah, the infrastructure, right, of having the staff, having the available, and the resources aren't always the brick and mortar housing buildings. There's a lot of challenges, I think. So thank you for bringing that up. We're hearing that, and it is definitely part of the ongoing conversation. So, and please keep speaking up and keep sharing the challenges that you're experiencing in the communities. And I will spend some time kind of thinking about if there is any resources that have come up, and I'll send those your way if I can find them.
Kimberly, you're on mute.
Yep, I was like, myself here. As other questions come about, I just wanted to pop up some additional resources. These are some resources that many of you may already have access to, but again, you're going to get this PowerPoint. These are all active links. So there's a bunch of ALTA links here: Pathways to Employment, Pathways to Housing. I just want to mention Pathways to Housing just got a really cool enhancement, updates, lots of new pages to check out. So if you haven't been on there in a while, please go check it out. We've added a page on ALTA, a page on transitional age youth, a page on peers. There's a bunch of new continuing education e-learning modules, just a ton of new information and resources for you to check out. So please go there. Of course, there's our training event and calendar for DBHR. So all of our fun webinars and trainings that we offer, we want you guys to have access to. Our provider map for FCS, and then a bunch of other commerce related links to check out as well. So please check out these things. Findhelp.org is another cool resource. It's got a ton of resources for you as providers to help get people connected to all sorts of things in your community. Please check these out. Please reach out to us if you have questions, want to have discussions about any of the programs that we talked about today, we're always available to do that work with you and help you support the folks you're serving in your communities. We really appreciate you joining us today. And of course, if you do have questions and we didn't get to them today, we are happy to connect with you outside to answer those questions for you. That's it for us today. We're at the 10 o'clock mark. Thank you so much again for joining us. We will be back again next month with a fun new topic, and please reach out if you have any questions. Thanks everyone. Happy Thursday.
Bye all. Thank you.